Mr. Jones, he's 64. He's active. He has a busy job, 3 kids. They're all grown, but a big part of his life, church and pickleball. That's his newest endeavor. On Thursday, Mr. Jones was diagnosed with prostate cancer. The first thought that flashes through his brain, it's fear. What does this mean? Am I going to die? A split second later, a second thought takes over. Really, it's a lot of thoughts. It's images, his children, his wife, his pickleball. Images of his life and what makes his life meaningful. And then, after the movie of his life plays, a third thought often comes. What is a prostate? I've had conversations with thousands of patients. I've provided lots of information, answered lots of questions, and these 3 slides, the information in these 3 slides, it's at the top of my list of most important. So get ready. So here we go. Background. The prostate is a small organ that sits below your bladder. People often say it looks like a walnut. The primary function of the prostate is to produce fluid that, along with sperm, is part of semen or ejaculate. Prostate fluid is rich in proteins and minerals that help protect and nourish the sperm. Prostate cancer, it's one of the most common cancers in men. Around 300,000 new cases of prostate cancer are diagnosed every year. Many men undergo surgery or radiation to treat it. Surgery is called a prostatectomy, and the majority of prostatectomies are now done using robotic-assisted techniques. So we call that a robotic prostatectomy. Stay with me. When I start talking about prostatectomy or robots or radiation, I have come to learn that people love to get off the highway. They love to start focusing and talking about all that fantastic technology. It's natural. It's interesting to talk about technology, and it's human nature to focus on how these special technologies will help cure cancer or cure disease. But please, let's keep the train on the tracks. Stay focused on bladder and sexual symptoms. Because no matter which therapy you have, they can all cause life-changing consequences or impacts. All of them. One of these impacts is urine leakage or incontinence, and a specific type called stress urinary incontinence. Stress urinary incontinence is urine leakage that occurs with exertion or effort. And it sounds like this. Dr. Rapp, when I cough, I leak. When I laugh, I leak. When I exercise or bend over and pick something up, I leak. Another devastating impact common after surgery or radiation for prostate cancer is erectile dysfunction. Erectile dysfunction is the inability to achieve or to maintain erections sufficient for satisfactory sexual intercourse. Let's jump to the whiteboard for some of the whys and the hows. Why do men treated for prostate cancer develop incontinence? Your bladder stores urine until you're ready to urinate. When that time comes, the bladder contracts, pushing urine through the urinary channel called the urethra. A key player in bladder control is this circular band of muscle that sits around the base of the bladder and the urethra. It is called the urinary sphincter. The urinary sphincter keeps the urethra closed until you consciously relax to urinate. And after prostate surgery or radiation, this sphincter can become weakened or damaged. When that happens, it may no longer be strong enough to prevent urine leakage, especially when extra pressure is placed on the bladder, like during exercise or coughing or lifting. So our story, like many, starts with the background and introducing our challenge, which is avoiding incontinence after prostate surgery. But how big is this challenge? What odds are we up against? Here we go. 3 slides. Slide 1, how common is urinary incontinence after prostatectomy? Essentially, will I leak urine? Let's dive into the research. This chart will give you some answers. On the y-axis, this vertical axis, is the percentage of men from 0 to 100 experiencing incontinence after prostatectomy. On the x-axis is the time after surgery, so 0 months right after surgery, 3 months, and 12 months postoperatively. This, what you're about to see, is the percentage of men that wear at least 1 pad because of leakage. 0 months. It's virtually all patients. That's to be expected, as you can imagine, after an invasive surgery to reconstruct the urinary channel. At 3 months, that number improves to the mid-50s. At 12 months, we see that number improve. This is notable because at 12 months, this is a very important time point. We believe that where people are at 12 to 18 months is a good predictor of where they're going to stay. So at 12 months, over a third of men in this study will be wearing a pad. Now this is one definition, and the definition of leakage or leaking urine is very important. This one being men who wear pads or don't wear pads. Another definition is a survey, meaning asking men whether they leak at all. Now, note that this is a different definition. For example, a man could report leakage on a survey saying, I leak once a week, but choose not to wear pads. Just leak in their pants, maybe change their underwear. This is why we test different definitions of incontinence. And these are those results in a survey analysis. Once again, you see 100% of men at time 0. At 3 months, fairly similar. Once again, at 12 months, again, even more men report some degree of leakage. Let that information sit for a moment. Really take it in. What it means is that after prostatectomy, there's roughly a 1 in 3 chance that you will wear pads in the long term. Now that chance plummets to 1 in 10 if you take the simple action of committing to a comprehensive program like H-Fitness. Didn't I tell you these slides were important? Ready for another one?